the whole falling?
Yeah.
Like, how much you want to hear about that?
Well, let's talk about the fact that you were up in, Colorado, ice climbing, and
Okay.
took a nasty mission.
Okay. Well, I'm an avid rock climber and ice climber, mountaineer. My injury started when I was in Ouray, Colorado, doing an ice climbing. It's the first climb of the season. I was being lowered into a canyon, and my belayer lost control of the belay about me 40 feet up. I had to kind of, I realized I was falling, and how much detail do you want of this?
Yeah, just keep going.
Okay, the whole thing, like.
Yeah, just tell me all this. Yeah.
Okay, so, I realized I was falling. As soon as I realized I was falling, I had to kick over and kind of slow myself down. I ended up, kicking over and glancing into the side wall of the original wall that I was coming down on. When I hit that wall, I ended up kind of knocking myself out, kind of, not completely, but I remember those last, 20 or 30 feet of falling. Do you want that much detail?
Yeah, I do.
Oh,
yeah.
Okay.
It's perfect.
Okay.
So yeah, keep going.
Okay. And I remember just thinking as I was falling that last 20 feet, I got one more impact to survive. And then it was like a thud, lights out. I was out. I think my friends say that I was out probably like 2.5 minutes. But when I woke up, I had to assess all the damage in my body. All right, so after I woke up, I tried to lift my arms, and I knew that there was something seriously wrong with my shoulder. I tried to sit up. I couldn't sit up. There was blood dripping off my face. It was a pretty bad scenario. Consequently, there was a guy there that saw the whole thing happen. He was able to wrap down into the canyon and provide a down jacket to keep me from going into shock. And then they called the ambulance. I was then basketed out of this canyon and shipped off to the hospital in Montrose. I had landed on my side, so when they assessed the injuries after a CAT scan, I had shattered my greater tuberosity in my shoulder. I had separated my skin from my muscle from probably like here all the way to my knee. I had broken my pelvis. Breathing hurt a lot because of the impact and the compression that I suffered. So it was a pretty traumatic injury. But what I didn't know is recovering from this injury, I probably had tweaked my back where the vertebrae had moved quite a bit as I landed, and it probably tore some fibers and weakened a disc in my back. I didn't really know it until I got through my full recovery. And then probably about 6 months later, I started experiencing pain in my back. Not severe, but it was enough that I went down to Walgreens, bought one of those cheap back braces, put it on, thinking, just I'll baby this thing, it'll be all right, no big deal. I constantly kept climbing on this injury, and it started getting worse and worse and worse, and then until I had my blowout. And I was in the gym doing a boulder move, pretty hard move where I was doing a lot of compression on my back. And one move, I just felt it. It was like, ooh, that was not right. Like, it was instant. It was kind of like, okay, something happened. And I quit climbing for a while, for like 30, 45 minutes, and I actually thought I was okay. I went back to try to climb again and was like, nope, that's not okay. I went home. Next morning when I woke up, it was like I couldn't walk. Could not get out of bed. It was so bad that I had pain shooting down my left leg. Actually, is this good?
Yeah, it's perfect.
Okay. Yeah, I had pain shooting down my entire left leg. It was excruciating. It was like somebody's dumping acid on my back and down my leg, and I tried to walk down the hallway. I couldn't do that. I had to like crawl to even get water. I remember calling my girlfriend going, this is just out of control. Like, I got to see somebody today. And so she ended up finding a spinal surgeon specialist in Northern Phoenix. I got an appointment and was there the next day. I was thinking, okay, you know, this, you know, medical, you know, Western medicine, they got all the answers, right? They're going to fix me. Like, I went from climbing extremely hard to not even being able to walk. I remember when I went into that appointment, I drove myself, and from the parking garage to that office was probably maybe 600 yards. I had to sit down 10 times. I could get up, walk maybe 20, 30 feet, and I'd have to sit down because it was just like the pain just was, it grew so much that it was just like I was going to pass out if I couldn't, you know, if I didn't sit down. So that was the only way I could alleviate it, was to sit straight up down like this, you know, and then the pain would alleviate enough that I could get up and walk again for another, you know, 20, 30 feet. I get in the office and I'm thinking, okay, I'm going to explain this to her, and she's going to be like, okay, yeah, you need an MRI, you know, you need this, you need that. What really set me back was, she's like, okay, here's a prescription for some steroids, and if that doesn't fix you, then we'll give you a cortisone shot, and if that doesn't fix you, then maybe we'll get an MRI on you, and if we determine there's a problem with you, then maybe we'll send you to surgery. And I was like, wait a second. I was like, I went from being an extreme athlete to not even being able to walk. I mean, it was obviously something was more wrong than just steroids and a cortisone shot, right? So I was kind of like set back on Western medicine at that point, and I remember calling my sister, and she's like, hey, have you ever tried this decompression therapy? Have you ever thought about it? She said it has fixed a lot of nerve problems in my back. She has like fibromyalgia. Tough to pronounce that word for me anyway. And she's like, yeah, it totally fixes me. And she goes, I go in, you know, once or twice a month and get maintenance decompressions, and it's great. She goes, you should try it. So I made an appointment and went in a few days later. After trying these steroids, I remember, you know, I couldn't sleep at this point, man. I'm talking like I was getting an hour of sleep a night. I was just turning and sweating, and the pain, there was nothing that alleviated this pain. It was out of control. So when I went into the office, they did an assessment on me, and he's like, yeah, he's like, you got a disc injury. You got a pretty severe disc injury. He goes, you know, let's do this decompression. Let's see what happens. And I was like, hey, you know what? At this point, this medical doctor, you know, the surgeon's just giving me steroids. I was up for anything at this point. Plus, I don't really like going under the knife. I've had surgery before, and I still have remnant effects from that. So I was like, oh, yeah, I'm willing to try this. Let's do this. So I went in and started the decompression therapy, and it lasted quite a while. Like it was, you know, I ended up going in total probably like 45 visits. It was a lot. I was going 3 times a week. For the first 5 weeks, nothing was happening. But as I was going in there, I kept increasing my weight, you know, that on the pole. And he's like, yeah, well, just keep increasing it until you actually see a difference in what's happening. So I'd get off the machine, I'd feel the same, and my back would be a little sore. And he would be like, okay, you know, next time we'll take you up 5 pounds. And I think at the point when I hit about, you know, it was about 115 pounds, it was about 65% of my body weight on these poles. It was like one day I did this pole, and I was like, when I finished, normally I kind of like, you know, they raise the decompression table, you know, and set you down, and you kind of walk off, and you still kind of feel that pain. I remember getting done with the pole and then taking the belt off, and I was like, I almost wanted to sit up like right away. I was like, whoa! It was like the pain is subsiding. Like I felt it. It was like instant. It was like, this is working, right? And I got really excited about it, and I was like, oh man, this is. And that night or the next morning, I was doing a test on my progress, and I was like in the shower, you know, there's those little shower drains, you know, and they got like the cross hatching in them, you know, and I was always stuffing my foot on there because my foot was numb, like I couldn't feel anything. And I remember that next day I stuck my foot on that shower drain, and I was like, I could feel it for the first time in like weeks. I was like, wow, okay. And from there on, it was just like every visit was just monumental in my progress. I was walking farther. The feeling was coming back. The pain was subsiding. I was sleeping better. It was just, and it was probably over the course of the next 15, 20 pulls, I was basically back to then hiking. I started hiking again on small mountains and small walks, full recovery. Well, it took a while, but now do I want to lead into?
Yeah, then talk about afterwards. Yeah,
Okay, so
here, let me go ahead and get it. Okay.
okay, yeah. So the recovery, after original recovery, where I can then walk again, and I was actually starting to jog and hike, and I realized that there were some things I had to do to maintain after I finished the decompression therapy. There were things I had to do to maintain my health and the stability of my back and the continual progress. One of them was I learned to sit up straighter, to really, to keep more of a straight back, lower back especially. I always used to hunch over, so I realized I had to do that. So I'm much more conscious of that. But more importantly, through the process of the decompression, I was given a belt by the chiropractor that was doing the decompression therapy. It's from Disc Disease Solution, which I'll show you in a little bit. But I would wear that on and off, like a couple times a week. And, just wearing the belt wasn't enough. It wasn't like decompressing me enough. I mean, I'm sure it helps, but what I learned was a technique to actually simulate the decompression therapy that the table does. And it's probably, it's not a substitute for actually doing the decompression therapy. I mean, if you have like the extreme pains and the sciatica and the numb foot and everything like that, you might want to think about the decompression therapy and paying for it. But if you're experiencing, somewhat mild, or you want to alleviate or maintain a healthy lower back, as I've discovered, then this technique is perfect. Of course, I'm not a medical doctor. It's just something I have discovered and use, on a regular basis. And I'm still climbing very hard, mountaineering, running, biking, and I experience very little to any side effects from my disc issue that I had, the herniation. This is the belt that I was given for my maintenance of my disc decompression therapy. And it's also, you wear it after disc decompression because it kind of helps aid the process of stretching your spine out. But what it does is it has a bunch of air pockets in it. When it's inflated with this pump, which I'll show you in a second, it expands and pulls your whole thoracic area apart, stretching your spine. And you want me to put it on now?
So then describe your technique.
Okay, so this is the technique that I've learned for maintenance of my lower back that keeps me fully functional with, I would say, little to no side effects from my disc injury. And what it serves to do is when you have an injury, your muscles in your back tend to get really tight, and it kind of compounds the issues because they get tight and they pull on that disc that's injured, and then you squeeze against it and it pulls more, and it's kind of like this vicious cycle that just gets worse and worse and worse. So what this technique does is it mainly serves to stretch those muscles out, like pull the muscles, and when the muscles can relax and pull apart, it allows your discs and your spine to relax and pull apart as well. And you can actually feel it. And the reason why I learned this is because I know what the disc decompression therapy felt like when I was on the table. And when I started experiencing, mild pains and things like that, I went to say, hey, how can I replicate that? What technique would work? And this is what I came up with, and it works beautifully. And what it is the belt holds a lot of compression around your abdomen here. And the technique works by breathing in and pushing your diaphragm down into this belt. And therefore, because it can't expand, it has to push out. And it basically pushes your pelvis and your lower body away from your diaphragm, which is then expanding your vertebra in your back and stretching those muscles and aiding in the disc decompression. Also, that what can be done other than that breathing technique is you can grab right here on your thighs and push away as well. And so, and you'll feel it because the belt is holding everything and pushing everything apart anyway. You're just aiding that process. And so what I'll do is I'll breathe in deeply, push my diaphragm down, which pushes my lower body away, and I'll hold my breath for like 20 to 30 seconds, whatever feels comfortable for you. But the more you learn how to do this, the better you get, and the more decompression you'll feel. It's pretty amazing when you start getting good at it. You'll feel, I even pop my vertebra, you know, and then hold them around, and I can feel them just stretching and stretching, and it feels great. But this is what it looks like. And then you just hold pressure here on your thighs as you're breathing and getting ready for your next decompression. And you just breathe in again. You breathe in, and you breathe in with your abdomen, pushing down, down into the belt. The belt then holds everything, and it pushes your lower extremities away, decompressing your back. And the better you get at it, the more decompression you'll get, and the better the effects you'll experience.